When palpating the muscles of the anterior knee, the extensors, your obvious bony landmark will be the patella, and from the patella we'll be using the heel of our hands on the lateral side and asking the patient to push the back of their knee into the mat while contracting the quads. So I'd like you to contract these muscles, trying to push the back of your knee into the mat for me, and contract. And this is a huge muscle all on the lateral side. By using your heel, this is mostly tendon in this area, so you can skip the tendon area and palpate on the vastus lateralis. For the rectus femoris, we just put the heel of the hand on the patella and go straight up, and go ahead and push the back of your knee, and we can feel the anterior part of that muscle is the rectus femoris. We are unable to palpate the vastus intermedius simply because it is deep to the rectus femoris. I'm going to switch legs to demonstrate the vastus medialis obliquus. Bring it out to the side a little bit. And we are going to really palpate this one. This is a very, very important muscle to palpate, not only to see if it's working, but the quality and for placement of electrodes for electrotherapy, either biofeedback or muscle stimulation. So we're going to use the three-finger method. We're going to find the base of the patella, go to the medial corner of that base, and use the 3 fingers. Going just 3 fingers to that, we will use our other 3 fingers, and when she contracts, we are 3 fingers above the base of the patella, and we use the next 3 fingers to palpate. When she contracts the quadriceps, go ahead and contract, and we should be right on the belly of the vastus medialis obliquus, or the VMO. That's a very, very important one to palpate. So I'm going to do that one more time. 3 finger space. The next 3 fingers are going to be our palpation fingers. They are going to push the back of the knee into the mat and contract. We will palpate both the quality and quantity of that VMO contraction. All right, the next muscle we are going to be palpating will be on the lateral side, and it's the only one on the lateral side that we're going to palpate of the hamstrings. There is no obvious bony landmark. We're going to simply come into the popliteal fossa on the superior or on the femur or thigh side and place our hands just behind the knee, and then ask the patient to dig their heel in as if they're trying to pull their heel towards their buttocks, but they're not actually moving the heel towards their buttocks. So go ahead and dig in, and we can feel a huge pencil thickness tendon right there behind the knee. It's the only muscle on the lateral side. That is the tendon of the rectus femoris, the long head, and the short head. On the medial side, there are going to be 3 muscles that we're going to palpate that are more superficial and one that is deep. The order is going to be in this order, from most posterior back here, coming up this way, going on the medial side of the knee, starting with the semitendinosus, moving to the gracilis, moving to the sartorius. The motion is going to be the same. She's going to dig her heel into the mat and pull towards her buttocks, but not actually sliding the heel towards her buttocks. No osseous landmark, except we are sliding into the popliteal fossa on the femur side, and go ahead and dig your heel in and pull. The most prominent tendon, the one that pops out on the medial side, is the semitendinosus. When she digs the heel in again, and now I come off of the semitendinosus like plunking a guitar. From plunk, the next tendon that is right next to it is smaller and thinner. That muscle is the gracilis. And relax. The next muscle will be strap-like. Remember, it's the sartorius that comes around, that attaches to the ASIS. So dig your heel in. We go semitendinosus, plunk to the next one. Gracilis, plunk to a beefy, thicker, strap-like muscle, which is the sartorius. One more time. Semitendinosus, gracilis, and sartorius. dig. Semitendinosus, plunk to the gracilis, plunk to the thicker sartorius. Once we have found these three muscles, we are actually going to go more posterior and dig deep behind the knee, but on the femur. And it's the only muscle left that we haven't palpated of the hamstrings, and that is the semimembranosus. This is going to be a beefy, thick muscle. You're not going to feel a tendon, but rather a beef muscle-like structure. It cannot be the muscle of the gracilis because it has a small tendon here. Semitendinosus is a lot of tendon. Sartorius is too anterior, so it's the only beefy muscle back there that's on the posterior side of the femur. So go ahead and dig your heel in. Once I find the semitendinosus, I go more laterally and posterior, and I dig in and I feel a beefy-like muscle. Relax and dig in, and relax and dig in, and that is your semimembranosus. The other three superficial ones, remember, all attached to the medial side of the tibia onto the pes anserine. We call those the pes anserine muscles. Semitendinosus, gracilis, and sartorius are your pes anserine muscles. Deep and more posterior is the beefy-like semimembranosus.